Help suppress appetite and lose weight with Lomaira. It's FDA approved for short-term use, a few weeks, and may help adults who struggle with obesity. The limited usefulness of this drug class, anorectics, including Lomaira, should be measured against possible risk factors inherent in their use. It's hard for some adults to lose weight. Even with diet and exercise, some still struggle to take off pounds. But why? There are many reasons why it can be hard to lose weight, including a person's environment and genetics. In addition, science shows that the human body's internal clock is geared to increase hunger during the evening hours, so that people continue to eat or snack at night before the fasting period during the sleep cycle. In fact, hunger is greatest between 4 and 8 p.m., the worst time to consume calories if you're trying to lose weight. No wonder it's such a struggle to lose weight. Lomaira is a low dose of the #1 prescribed weight loss medicine in the U.S., phentermine. Healthcare professionals have prescribed phentermine for weight loss for over 50 years. More than 125,000 healthcare providers put their confidence in phentermine, and more than 7 million prescriptions are written yearly. Lomaira is usually taken 30 minutes before eating breakfast, lunch, or dinner. You can't do that with the higher doses of phentermine, which are taken in the morning when people may not struggle with their appetite. Because Lomaira can be used up to 3 times a day, patients and healthcare providers can customize a treatment plan that fits each patient's unique lifestyle. Every patient's eating habits are unique, and with Lomaira, every patient can be prescribed a unique treatment plan. If you need only a modest dose before dinner, there may be no need to increase the dose, and therefore, Lomaira can cost you as little as $15 a month. That's about 50 cents a day. Lomaira dosing should be individualized to obtain an adequate response with the lowest effective dose. The usual adult dose is 1 tablet 3 times a day, 30 minutes before meals, and the Lomaira tablet is scored so that 1/2 of the usual dosage can be administered for patients not requiring the full dose. Phentermine hydrochloride is not recommended for use in pediatric patients 16 years of age or younger, and late evening medication should be avoided because of the possibility of resulting insomnia. Not everyone can use Lomaira, so ask your healthcare provider if Lomaira is right for you. You can only get Lomaira with a prescription from your doctor. Talk to your healthcare professional today.
Don't take Lomaira if you have a history of coronary artery disease, stroke, arrhythmias, congestive heart failure, or uncontrolled high blood pressure, are taking or have taken a monoamine oxidase inhibitor drug within the past 14 days, have overactive thyroid, glaucoma, agitation, or a history of drug abuse, are pregnant, nursing, or allergic to sympathomimetic amines such as phentermine or any of the ingredients in Lomaira. Taking phentermine with other drugs for weight loss is not recommended. Primary pulmonary hypertension, a rare fatal lung disease, has been reported in patients who had taken a combination of phentermine and fenfluramine or dexfenfluramine for weight loss. The possible association between phentermine use alone and primary pulmonary hypertension cannot be ruled out. Patients should tell their doctor immediately if they experience any decrease in the amount of exercise that they can normally tolerate, shortness of breath, chest or heart pain, fainting, or swelling in the lower legs. Serious heart valve problems or disease have been reported in patients taking a combination of phentermine and fenfluramine or dexfenfluramine for weight loss. The possible role of phentermine has not been established, therefore the possibility of an association between heart valve disease and the use of phentermine alone cannot be ruled out. If your body becomes adjusted to the maximum dose of phentermine so that its effects are experienced less strongly, the maximum dose should not be exceeded in an attempt to increase the effect. Caution is advised when engaging in potentially hazardous activities such as driving or operating machinery while taking phentermine. Phentermine has the potential to be abused. Keep Lomaira in a safe place to prevent theft, accidental overdose, misuse, or abuse. Using alcohol with phentermine may result in an adverse drug reaction. Phentermine can cause an increase in blood pressure. Tell your doctor if you have high blood pressure, even if it's mild. If you are taking medicines for type 2 diabetes, your doctor may have to adjust these medicines while taking phentermine. Some side effects of phentermine that have been reported include pulmonary hypertension, valvular heart disease, palpitations, increased heart rate or blood pressure, insomnia, restlessness, dry mouth, diarrhea, constipation, and changes in sexual drive. These are not all of the potential side effects of phentermine. For more information about Lomaira, ask your doctor or pharmacist. To report negative side effects of prescription drugs, contact FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For full prescribing information for Lomaira, please visit www.lomaira.com.